Hello, my name is Fabiola Miranda. I am one of the nurses on your case, and I just wanted to go over the procedure with you again and make sure you understand everything and answer any additional questions you may have. The goal for this surgery is that we remove all the cancerous tissue on your cheek. The particular cancer you have is basal cell carcinoma. This means that the tumor has developed in the basal cells, or the deepest layer of your epidermis. A tumor is a new growth of tissue in which cell multiplication is uncontrolled and progressive. This type of cancer is usually caused by a cumulative amount of intense sun exposure and often presents as small pearly nodules or plaques. The good thing about this cancer is that it is usually not metastatic. This means it does not often spread to other parts of the body that are not of the place of origin, and that in your case we have managed to catch it early. Often when it is not caught earlier, it can lead to disfigurement, particularly around the eyes, ears, and nose. This particular procedure is called the Mohs procedure. It is the most effective technique for treating BCC and is done in stages. You will be given a local anesthetic on your face to numb the tumor area. Then you may feel some pressure as the surgeon removes the thinnest layer of skin from the cancerous area with a scalpel and sends that to the laboratory for more testing. The sampling process is called a biopsy, which is when tissue from the living body is removed and then examined under a microscope. Often, this is done to establish a diagnosis, but in this case, we already know the cause. A pathologist, who is a specialist who supervises diagnostic tests using material from living or dead patients and functions as a lab consultant, will analyze the sample in the lab and identify the healthy tissue from the cancerous tissue. The removal of the first tissue sample should only take a few minutes, but the wait time while the sample is processed in the lab may take a few hours, so feel free to bring a book with you while you wait. If the lab determines that there are still cancer cells on your cheek, this process may be repeated until all the cancer cells have been removed. There is some risk of scarring with this procedure, but know that of all the procedures, this one has the most minimal scarring risk. Depending on the removal process, the surgeon may leave the area open to feel or close it with stitches. You may require an additional doctor, such as a plastic surgeon, if there is reconstruction needed, such as skin flap or grafting, which is when neighboring tissue is moved to the wound area. Once in recovery, remember that you are to avoid strenuous work for 24 to 48 hours. There may be some discomfort such as bruising and swelling, which may be helped by a cold compress, rest, or over-the-counter pain medication. Be on the lookout for any wound infections. Do you have any additional questions for me? No? Alright, well then I wish you the best with the surgery and I will see you in the operating room.